Hello, everyone. I'm Mercy Jatto. I'm an ENT surgeon and a clinical researcher at the University College Hospital Ibadan in Nigeria. I would like to share a bit of my work with you on Now Listen.
Welcome back, Dr. Jatto.
Thank
Today,
you.
I'd love to discuss a little bit more about the state of ear and hearing care in Nigeria and in the specific geographic regions that you serve. So can you tell us more about the main hearing-related medical problems that you see in your practice and in your community?
Okay. The state of hearing and hearing care in Nigeria is still developing. We still have a very long way to go, basically. In my country presently, practicing certified ENT surgeons, probably about 200, 250, to a population of about 200 million people. So you can imagine the ratio. And the number of trainees, quite few, if you compare to the number of people we have to cater to. So we're still developing. About 40 to 50% of the patients we see in clinic are mostly patients with otology kind of cases, hearing loss, chronic ear discharge, acute ear discharge. It may surprise you to know that quite a number of patients still deal with chronic ear discharge in my country. In short, most people don't even consider it a problem, more like a nuisance. Like they don't see it as something serious, like, oh, yeah, it's just discharging, whatever. Yeah, so those are the kind of cases we see typically in practice in Nigeria.
And what type of challenges do the patients and families you see have in accessing hearing healthcare?
Oftentimes, we don't have more than 90% of the patients, people, let me not just say patients in my country, don't have health insurance. You have to pay out of pocket for your healthcare. And in an economy where a typical household probably earns about $200 to $300 in a month, healthcare most times is in the background, except in cases of emergency. And so for the patients to be able to access healthcare, it's expensive. Even with the subsidy of the government and all of that, it's still unaffordable to most people, except they have to come, which of course is an emergency in that instance. And that's on the part of the patients. On the part of we, the practitioners, equipment, training. And that's one of the things I'm really grateful to the House Foundation for. They donated a microscope to my hospital. And it's gone a long way, It's things like that, basic things like microscope, like telescopes, basic things that we should have. We're still struggling a bit. But again, I keep saying we're better than yesterday, but we still have a ways to go, but we would get there. And training. Of course, the world is moving forward. You want to move with the technology. You want to move with new advances in medicine. So we have a bit of a challenge with training and research, things like that. But then I'm optimistic we're getting there gradually.
I noticed that in 2018, I believe the federal government of Nigeria launched a national policy and strategic plan on ear and hearing care, which is wonderful. And you mentioned, there's still a long way to go, of course. In the last few years, have you personally noticed any changes in the field of ear and hearing care or certain trajectory? And if so, what does that look like?
At least first, I would say more ENT surgeons are taking interest in the subspecialty of otology. So that's a positive. Audiology, which is part of the diagnostic arm in otology, is getting a boost in the country. Also, that is a positive thing. At least policies, the government is beginning to take notice, make plans towards improving hearing health in the country. So I think quite a number of things are still in the planning stage. Hopefully, when the plans are done, we would be able to see actualization of those plans. But for now, the government is interested, they're planning, they're making moves. People are training, we're getting ready, and things are moving forward.
Yes, it takes time, but with commitment and multidisciplinary teams, You will get there, and many other countries too.
Thank you for watching our video. You can support research like that of Dr. Jatto's, as well as other programs run by the House Institute Foundation in Education and Global Health by following us on social media and, more importantly, going to hipla.org/donate to give a gift today. Together, we can create a world where everyone has access to the ear and hearing care they need.